Today, we are going to talk about the assessment of ADHD in adults. As we know, it's a very topical subject these days. Attention deficit hyperactivity disorder, as it is known as, is one of the neurodevelopmental disorders that comprises mainly of symptoms like inattentiveness, hyperactivity, and impulsivity. Now, these are things that affect people at some point in their lives. For instance, if you have a late night or if you haven't slept well, then the next day there are people complaining of poor attention. However, for people with ADHD, these problems start during childhood and then they continue more or less throughout life, although it can change in form and substance. Now, just a bit about the statistics. It's roughly about 3 to 4%, which means that if you look at every 100 adults, about 3 or 4 of them will have ADHD at some point. ADHD assessments can be quite challenging as it can present with a wide range of symptoms that can mimic depression, anxiety, or personality disorders, including, of course, the complex symptoms relating to diminished focus, inattentiveness, or short attention span, poor concentration, restlessness, hyperactivity, distraction, mind wandering, impulsiveness, and difficulty organizing and poor time management. As you know, some people refer to the poor time management as time blindness. So how these symptoms present and change or interfere with the different domains of an individual's life may change over a period of time as one gets older. And also remember that these core symptoms may sometimes present differently in men and women. Psychiatrists at the Edinburgh Practice are all experienced senior clinicians with active links through their present or past work with NHS. During the assessments here, they will carefully assess your developmental history, school and university experience, and current circumstances. They will also consider any existing comorbid, physical or mental health issues and the impact your symptoms are causing on your daily life, which can include work, relationships, finances, friendships, mental and physical health. An important part of the assessment that we focus on here at the practice is gathering corroborative information from someone very close to you, in most cases parents, wherever it is possible. The assessment also includes a semi-structured interview using the diagnostic schedule called DIVA-5. Now, once the assessment is complete, a detailed feedback is provided to you along with the report, and following the feedback, if ADHD is indeed diagnosed, then you are provided with quality information and an option for you to consider medication. At that point, there will be need to organize titration appointments to develop an individual treatment plan. And once the titration is complete, wherever it is possible and acceptable to your local GP, a shared care agreement will be prepared, and then the GPs are requested to take over your medication, while the follow-up remains with the clinicians at the Edinburgh Practice. However, there are cases where it is not possible for your treatment to be passed over to your GP. In such cases, the Edinburgh Practice has the means and facilities to provide you with private prescriptions to continue your treatment. Now, along with or sometimes without the medical treatment. Some people prefer psychotherapy, or as nowadays we call it, ADHD coaching, which is also conveniently available, where senior psychologists offer these at the Edinburgh Practice.